So they wanted to talk about Phacodynamics because they started doing Phaco, and you know, Phacodynamics is a very important thing, and I want to talk about Phacodynamics in a very different way. Because every time people talk about Phacodynamics, there's a point where I'm like, oh my God, I have more doubts that when I started, well, this. So we're gonna do the opposite. I'm gonna go extremely simple. And from simplicity, then I'm gonna go a layer deep, and a layer deep. And I'm not gonna go deep enough. We can go deep enough in the next few days. But whether you like it or not, how many numbers do you see there? How many numbers? ¿No? ¿Cuántos números ven ahí? ¿Qué se va? 10, 12, no sé. Llega un momento que uno se pierde. ¿Por qué? Y que acá, que tengo que... Ya, o sea, tu cerebro ya se resiste a esto. So when you see a lot of numbers and a lot of things in a screen, your brain actually, says, oh my God, this is too much. But then you know how easy this is going to be, and it's going to make total sense to you guys. Okay. So we're gonna again talk about Phacodynamics. We're gonna go about Phacodynamics from a simplicity and one layer in very simple ways, and then we're gonna go deep. And here we're gonna have a Centurion, which is one of the most advanced machines to go from simplicity to more complex things. But whether you like it or not, this is gonna be pretty simple. Why? Because this is your universe, remember? And your objective actually is pretty simple. And what you have in order to accomplish it is very simple too. So you're going to have a lens with a nucleus that is bigger than the opening that you have in the rhexis. And in order to solve that, you're going to have what? You're going to have this. Okay? In this, you have a handpiece which has the capability to deliver ultrasound, which is energy, and also, as you can see, has something that irrigates, and you put liquid inside, and aspiration, which is going to remove things from there. Okay? This is what you have. Very important, and we're going to talk a lot about, is the interaction between the sleeve and the incision, and the pairing between the sleeve size, the type of phaco tips you can have, and the types of sleeves. So again, what we said was this: you can deliver ultrasound, which is energy. You're going to have irrigation. Yes? And you're going to have, and I'm going to put it on purpose here because they're going against, you're going to have aspiration. And aspiration. You're going to have also something that you create, and this is going to depend on the machine, something called the vacuum. Can anybody answer the difference between aspiration, that actually you're going to have an aspiration rate, and vacuum? Endothelium, you're going to pay taxes to. The lens, you need to remove it. The sonula, and most of all is the posterior capsule. That's going to be 4 microns. Okay? Anterior chamber, endothelium, sonula, lens, and posterior capsule. You have a phaco tip, but there are different types. You have a sleeve with irrigation, ultrasound, and aspiration and vacuum in a peristaltic pump. You're going to see that in a venturi pump, you only are going to have vacuum. Just remember that. For example, you have a Stellaris, you only control vacuum. Why? Because it's a different pump. This pump is a roll that we're going to see now that rotates, okay? And you're going to have a different vacuum. Now we need to talk about ultrasound. So let's talk about ultrasound for 1 minute. I'm sorry. And let's call it from another perspective. As you can see, you have different types of ultrasound. You have longitudinal and you have torsional. For that, I need to tell you this. Torsional is something that the Alcon machine has, and it's going to look something like this. Because in ultrasound, the frequency is always the same. What it changes is the displacement. Okay? Okay, is the displacement of the tip. So this is longitudinal, almost all the machines have. Other machines can have something called like oscillatory or different. And this is torsional. To have a torsional tip, you need a special tip that has an angle. Okay? But again, so two different types on how to move the ultrasound. What evidence tells us is that the torsional is more efficient and saves more ultrasound. But it's something you can discuss, and you're going to find other brands that are going to say different things. You need to have critical thinking for that too and understand it. Okay. Also, when you come here, you're going to have different ways on how to deliver the ultrasound. That they're going to be continuous, pulse, or burst. For others, I always like to make the questions, but for a matter of time, I'm going to say it so you can understand it, and then we can discuss about it. But when you have continuous ultrasound, makes total sense that it's something like this. Okay, you go to position 3 in your foot pedal, and total sense, right? When you have one that is pulse, I think the name says it. What is a pulse?
Just interrupt.
Show me how. I want to hear it. Very, very good. Pulses. Now, the question comes for the people who really know what they're talking about. Now, can somebody explain me what burst means?
A short, it's kind of like a pulse, but it's not this on off is not the same. So it's more as you press the pedal, as closer it will, like eventually it will become continuous.
I kind of understand what you're trying to say, but I'm not seduced by it. So again, be impeccable with your word and explain us what burst is.
It's a short burst of the legation. It starts like the pulse, I guess.
I guess. So if you're guessing, you don't know what you're talking about. Bring me the foot pedal. Pásame el pedal, por favor. So let's hear it. So let's go and understand what's happening. Look at this. Continuous. Makes sense. Pulse. And this is high frequency, but we can change the frequency. Makes sense. Now, let me show you burst. Listen to it. What did you listen to?
So you can hear that it sounds first like a pulse, but as longer as you press the pedal, as closer the pulses come to each other.
Oh, now we're talking. Now you're talking, and there is a little more detail to it. That is what? That the pulses are going to change in intensity as well. Make sense? I'm an artist. I mean,
I would quit my day job just yet.
what do you guys think? Make sense? So the intensity is going up, and the time between pulses is getting shorter. In my opinion, this is the one I like the most. You know why? Because I control whatever I want with my foot pedal. I want continuous, I can do it. I go all the way here, continuous. I want pulses, I can actually even control the pulses. Okay, so this is what I think. You're gonna find other surgeons who are gonna say, I like pulse, I like continuous. Okay, so again, critical thinking, doubt about everything, doubt about what I'm saying. You can, make your own things. There is another thing I really want to pay attention. Come a little bit closer to here. So come. When we talk about surgery, when we talk about phaco-dynamics, we cannot miss this. And the evolution of phaco-dynamics was about this. Was about we started doing big incisions with tips that were longitudinal, as you can see here. Okay, there were big. There were big endings, with a big area, but completely rectilinear. So you can only do longitudinal ultrasound. And that was maybe a 3.2 incision. That was the early phaco. Then at some point, Alcon released Infinity with what they call the Kalman tip, which had an angle of 45 degrees, okay, which was what? Torsional, the capability to do torsional. This was called the Kalman tip. And they started doing incisions of 2.8 with a violet sleeve. What we're doing now is with a new tip, it's called the balance tip, which is extremely efficient. Okay? That is like a goose neck, okay? Goes up and down. It's called the balance tip. And we can do even incisions of 2.2. But again, remember, guys, there is different knives for 2.2 and different knives for 2.8. So you need to be aware about everything. Which knife are you going to use? Which sleeve are you going to use? Which phaco tip you're going to use? Okay? Good. So we talk about ultrasound. Now let's talk about fluidics. Sorry, let's put another color because fluidics actually are more complex than, and in fluidics, we have irrigation. Makes sense, right? What goes in. And aspiration. Vacuum. That goes in red. What I want to tell you a little bit about irrigation is that in the past, we used to use gravity and the height of the bottle. Okay, I did my fellowship with Infinity. I will say to do sculpting, I will have a bottle of 85 centimeters, 95 when I go to quadrant removal, I will change heights. But then Centurion came and it has a different way how to reason. Now the bag is inside here and the machine is giving me IOP. So it's telling me, I don't care about height anymore. You tell me which IOP do you want in the lens, in your universe, near your chamber, I'm gonna deliver it. I'm gonna have the bag that I'm gonna press, and then I have right here this light that you need to put the patient eye level, PEL. So I'm gonna give you 38 of IOP at that level, period. Okay? Good. So again, remember here, we could say bottle height, and there's many other machines that are gonna use still bottle height or IOP. About aspiration and vacuum, just remember this. You're gonna have a peristaltic or a venturi pump. Completely different between each other. A peristaltic pump is a more a deluxe pump that you, in aspiration rate, what you control is how fast that pump is coming. So when we are talking about aspiration rate, is right here, we're talking about the speed of the surgery. What I recommend to you guys is what? In the beginning, go slow and safe. When you get good, you start rising it. And that means, what it means, safe and go, you can start from 25, go to 30, and when you start getting good, you go to 35 and 45 maybe. Okay? Vacuum is going to be used, especially when you want holding power. You want to grab something and hold it into you. Okay? So this is very important for you to understand. Aspiration is going to be flowability, flow. And vacuum is going to be holdability, hold. We really need to talk about this, and this is the simple stuff. Then we're going to go a little bit deeper when you do one and when you do the other. And guess what? That's it. Because the most important thing now is everybody's waiting to take notes about the settings. I want to know the settings. Please give me the settings. I want to have them right in my pocket. And there's nothing more far away from the truth, because you need to understand your machine. And the first thing you need to understand is that Phaco is done with what? With your feet. Meaning that you can have all the settings you want, but what you really need to train here is to this. You need to train yourself to see what's going on, pattern recognition, and listen to the machine and make decisions. Maybe I'm not delivering the 575 that I have, you see? Maybe I'm not delivering the 100% of torsion. So you need to have the correct setting, yes. But you need to be aware of that you're going to be delivering this with your feet. And also you're going to be changing your settings depending on what you're seeing. What I can do tell you is this, is that this being said, does anybody has to take a picture? Can you take a picture of this piece of art? I like more drawing than even do, sorry, yeah. I'm gonna put a trademark here, trademark. Okay, so because I want to erase this, because now we're gonna go to more of the cognitive stage of this and how to make decisions. Okay, now let's talk a little bit about what's happening, and so you are more relaxed about all these settings you're gonna do. You're gonna have sculpting, you're gonna have quadrant removal, you're gonna have epinucleus, cortex, polish, and viscoelastic. With that, you're more than enough ready to do something. So you're gonna do sculpt, you're gonna do Q-arc as quadrant removal. In quadrant removal, you can also have a chopping technique. Well, actually, maybe we can put a chop as different. You can have epinucleus. And then maybe we can put cortex because the rest are going to be easier. Okay, so what I want you to remember is this. In sculpting, ultrasound is king. Male, king. And in quadrant removal, fluidics are the queen. Different sex. Hope you never forget that. If you never forget that, I'm going to be happy. Why? Because now you are starting to understand and to reason what's going on. Here in chopping, fluidics are going to be the queen too. Okay? But fluidics plus mechanics. In epinucleus, what you want is safety. So let's go very fast to this, and then we're going to talk about in volume number 2 of this class, because I really want you to keep it simple. What I'm going to do in sculpting then is I'm going to put continuous ultrasound. I want to break. So ultrasound is going to be high. It's going to be the king, and ultrasound is going to be what you need in that case in order to do it right. So you're going to adapt the ultrasound for your phaco tip, for the type of cataract, and for the state of the sonula. Why? Because you want that ultrasound and that tip to displace like it's butter. One. If it's too hard, ultrasound goes up. If it's too soft, ultrasound goes down. You need to learn how to do it. Go in 3, come back in 1. And also remember we can talk a lot about these details, but I don't want it to go in how to sculpt. I want you to know only the settings. In quadrant removals, we said fluidics are the queen. So what you're going to need to have in mind is that you're going to need to have the correct, let's put it here, the correct size of the fragment, because if this, it doesn't matter if you have the best settings, if the fragment is too big, you're going to do twice as much. But you're going to have ultrasound, which again is going to be the correct for this, the hardness of the cataract, that you need to learn how to do that. You're going to have a IOP. Again, remember, you can change IOPs. We're going to talk about this in the volume 2. You can change IOPs depending if you have something called the active century or not, that this is for a new machine for another time, but you're going to have high vacuum and high aspiration rate. Which vacuum and which aspiration rate is going to depend on your knowledge and the number of cataracts. What I will strongly recommend is you can put 25 or 30 and a vacuum of 450 or 400 right in the beginning. These are settings which are going to be, good for a cataract for you guys. If it's not hard, these are mind settings for, I will say, a normal cataract. Ultrasound that is burst, 60 of torsional, 450 and 30. Okay? The IOP needs to compensate the vacuum and the aspiration rate. In epinucleus, what you want is less. You want less ultrasound, maybe not this less, but let's put it in 50, because now the fragment is low, it's soft, and you have less vacuum and less aspiration rate because you want safety first. With cortex, ultrasound disappears, and you can use high vacuum and high flow because you want to bring the cortex to you. Polish is very low because you just want to more mechanically go and remove something. And viscoelastic should be high because to remove viscoelastics takes time. Go again. Your universe, something coming in, something coming out, something destroying. You need to understand all the interactions between the phaco tip, the sleeve, and the incision. You need to understand the machine you're using, if it's ventral or peristaltic. And you need to understand that in different steps of surgery, you're going to put different settings and different parameters. Why? Because you need different things. In sculpting, you're going to have a continuous ultrasound that has the amount that you need in order to face that cataract. In quadrant removal, fluidics are going to be the queen, and you're going to have a high vacuum and a high aspiration rate because you want the fluidics to do the job. I don't want to hear this. Ultrasound like crazy. I don't want to hear that. What I want to hear is occlusion and ultrasound from time to time. Okay? Occlusion and ultrasound from time to time. We're going to talk about this in the second class.